Diabetes 2. Miracle cure. Insulin is in excess for diabetes 2 patients. Body uses insulin to take glucose inside the cell. Somehow for diabetes 2 patient, insulin cannot force glucose to enter the cell. Person takes more insulin to force the glucose entry into the cell. This causes two problems. First problem. He become obese because more glucose are forced into cell. Second problem. He became insulin resistance and he will need more insulin day by day. Diabetes and blood sugar level are two different things. Diabetes occurs due to insulin resistance. Blood sugar is a symptom of insulin resistance. Consider. Like in bacterial infection, bacteria and fever. Due to bacteria we have fever, and if we give anti-fever drug, it will reduce the fever but it will not do anything to bacteria. All the treatment are now directed towards the decreasing the sugar level, that will only reduce the sugar level temporary but it will not cure you. You are not actually treating the disease but you are treating the symptom. We have to treat the insulin resistance but not the sugar. When you eat, blood sugar go up, insulin is released to take the glucose and put it inside the cell. High insulin level is due to insulin resistance. Insulin is actually causing the insulin resistance. If you take any medicine for a long time, you will become resistant to it and later you have to take higher and higher doses. If you take more insulin, body will develop more resistance. If your insulin level is high, you will get insulin resistance, and it is a vicious circle. So giving insulin will make you worse and keeping you in infinite loop. If you understand this, you will know that current treatment is not working but also making you worse and bad. You cannot get cured by taking the insulin as for example you cannot treat alcoholic person by giving alcohol. People don't understand this and doctors give excuse that this is progressive disease but it is not in reality. This is absolutely curable disease if you understand the science behind it. Our allopathic treatment is completely incorrect. Treatment considerations. 1. Key to treatment is reducing, not increasing the insulin. 2. Diabetes is a dietary disease, needs a dietary treatment. 3. Diabetes is a curable disease, not a chronic progressive disease. A simple way to lower insulin is intermittent fasting. So if you do fasting, insulin level will go down. We can break that vicious cycle. How it works. Body has ability to store energy in two ways. 1. Sugar, glycogen, limited short-term storage, in liver and it is readily available when needed. 2. Fat, unlimited store in the body. This is long-term food storage. If we have too much sugar, some will go to stores and if stores are not full, it will not spill in blood. But once stores are full, it will spill into the blood and you can see increased blood glucose level. Over time, in diabetic, storage is filled up and full and more sugar will not go into the body, but spill into the blood. If you take insulin to take care of that problem, body will push that sugar into the body and you gain weight and you are going against nature of forcefully pushing that into the body unnaturally. To cure it, we need to fast, fast and fast. More you fast, more early you will get cured. How to cure diabetes. 1. Alkaline diet. 2. Intermittent fasting. Also take homeopathy instead of modern medicine whenever you are sick. Go to www.whomo.org to find your medicine. Diet and diabetes. We have to understand what to eat, what not to eat and when to eat to cure the diabetes. What to eat. Eat anything which is alkaline. Alkaline food includes lime or lemon water, fruits, raw or boiled vegetables. See the chart in next tab. Eat lot of alkaline foods to cure yourself. What to avoid. Avoid acidic food. Acidic food is shown in next tab. Avoid processed food. Avoid allopathic medicines. Avoid vaccination. Avoid sugar. When to eat. Follow intermittent fasting and fasting rules in next tab. Alkaline diet. Eat lot of alkaline foods like spinach, broccoli, artichokes, seaweed, lemons, red cabbage, cucumbers, onion, carrots, kale. Baking soda, lemon water. Sweet potato, melons, lettuce, zucchini, avocado, okra, dates, figs, pears, beets, green tea. tomatoes, mushrooms, wild rice, olives, pineapple, peaches, apples, bananas, almonds, tofu, apple cider vinegar. Fasting and intermittent fasting. Consider there is bowl inside our body which gets filled with glucose, and after it is filled, it spills the more glucose in the blood, raising the blood glucose level. To cure the diabetes too, we need to empty this bowl, and then glucose will not spill in the blood and there will be no diabetes too. Whenever you eat food, glucose enters in your body and insulin is released to digest that glucose. So in diabetes too, there is excess of insulin because of lot of glucose, and to digest those, body releases lot of insulin. Now aim of cure is to decrease the insulin production naturally. And to reduce the production of insulin we have to eat infrequently, as body will produce insulin if you eat something. There are two ways to do that, one is to do fasting and another one is intermittent fasting. Though whenever you eat, you have to eat alkaline food. Fasting methods. Diet 1, 16/8 method. The 16/8 method involves fasting every day for 16 hours and restricting your daily eating window to 8 hours. Within the eating window, you can fit in 2, 3, or more meals, alkaline only. Diet 2, 2 time per day fasting. Eat only 2 times a day, including everything in 50-minute period each time. Don't eat or drink anything except this 2 time, you can have water or lime water other time. Main step to reverse your diabetes. Avoid allopathic medicine. If you have not started any allopathy medicine, then don't start in future also. If you are taking any allopathic medicine, then stop it immediately. If you are taking insulin, then reduce it 50% now and stop it in 15 days. Created by Dr. Manish G. +919156771885, WhatsApp only, Telegram, @Mikulaxi_ecom. Diabetes Eradication Project 2020. Spread this message to everyone in India so that 6.2 million people, diabetic patient, can cure themselves in few days using fasting and alkaline diet.